Hi, my name is Thomas Cherian. I am a liver specialist, and one of the commonest questions I get asked is, Doctor, what is fatty liver disease? Well, as you can imagine, fatty liver disease is replacement of the liver cells with fat. Actually, it's a little bit more complex than that. Fat accumulates inside liver cells, which slowly leads to destruction of these cells, and these cells are then replaced by scar tissue. This process is what we would describe as going from normal liver to fatty liver to fibrosis and finally cirrhosis. So how much of fat is okay? Well, up to about 10% is what I would call normal. Anything above 10% of fat that is visible on the microscope in the liver cells would be considered abnormal. And if it is more than 30%, it would be called severe steatosis or severe fatty liver disease. So the real question is, why should we talk about fatty liver disease? Well, it's not funny because we are sitting in the fatty liver disease capital of the world. We have more fatty liver disease than any other country in the world by far. Unfortunately, our genes dictate that even with a mild form of obesity, just a little bit of fat around our tummy, there is a possibility of us developing fatty liver disease. A white Caucasian male has to become quite obese before they develop fatty liver disease, whereas we can be thin with a little bit of a belly and still have grade 1 or even grade 2 fatty liver disease. So this is why we all should not only talk about it, we should take steps to prevent this from happening. It's quite strange that this is true because we are actually a poor country. What's a poor country doing with fatty liver disease? But these are facts that we cannot shy ourselves away from. The next question that people ask is, Doctor, what are the symptoms of fatty liver disease? Well, the first thing I say is, be careful. Early fatty liver disease or even late fatty liver disease until fibrosis starts to set in, which is the stage after fatty liver disease, there are no symptoms. This is an absolutely important fact that I would like everybody to know. Early fatty liver disease or even late fatty liver disease until the stage of fibrosis and then cirrhosis, there is no symptoms often, and therefore the only way to tell would be to do blood tests and an ultrasound scan. So my point is, if you think you are at risk for fatty liver disease, and that is either you are known to have diabetes or you know you're obese. Obese simply means you're fatter than what you should be for your height. Then please get a simple blood test anywhere near your home, get a simple ultrasound, and if it shows fatty liver disease, then immediately take steps to reverse those things. Feel free to ask help from any specialist near to you. If you want, obviously you can come to us. And one of the things that we pride ourselves in fact, I have done over 650 transplants in my career, 250 transplants in Hyderabad. But I would consider that if I can transfer a patient who has got, let's say, grade 1 or grade 2 fibrosis back to a normal liver, I would be happier than doing a transplant in somebody who needs a transplant because he's already reached end-stage liver disease. So my feeling is, let's try and prevent this pandemic. Everybody talked about COVID as a pandemic, but to be honest with you, there is a bigger underlying pandemic where nearly 20 to 25% of us above the age of 40 have got fatty liver disease, and therefore it is high time we bring this into our discussions and try and mitigate it when we still can.